Hello and welcome, folks. Today you're joining us for the Actionable Insights podcast. It is a mini series within the Global Leadership Exchange's broader podcast series, and this is really focusing on the Leadership Exchange coming to Canada in June 2026. So we're trying to connect with folks that have a leadership role in bringing this incredible exchange to Canada to hear a little bit from them about why these conversations are important and from their perspective, what the importance of knowledge mobilization within leadership is and how we can really embody that as leaders across the country. So today I'm joined by Stephanie Priest, and Stephanie, I'm going to ask you to introduce yourself to our listeners.
Absolutely. Thanks, Shauna. As Shauna said, I'm Stephanie. I am currently the Director General for our Centre for Mental Health and Wellbeing here at the Public Health Agency of Canada. I am located here in Ottawa, Ontario, Canada, which will be the site of our GLE exchange in June. We're really excited about that. Ottawa is situated on the unceded territory of the Algonquin and Anishinaabe people. And in Canada, you'll often hear us recognize the land in which we are located. It's really important for many of us because it helps to ground where we're located, where we've come from. It recognizes the custodians of our land, and it kind of tells me a little bit about my history and my people and where they came from as settlers. Sort of knowing where you come from helps you go together towards the future. So I know we have a lot of people who aren't from Canada, and you probably hear Canadians talk about the land that they're on, the First Nations, the Inuit or Métis land. Personally, this is why I think that is important and a little bit of the history around acknowledging our history in Canada and why it's important for the future.
Thanks, Stephanie, and thanks for starting us off in such a good way. And I'm also very privileged to be joining Stephanie, also from what's called Ottawa, Ontario, but also known as the unceded and unsurrendered territory of the Algonquin and Anishinaabe people. And I love when you're talking about moving forward together. And kind of grounding ourselves in where we've come from and where we are now. So I'm going to start with a little bit of a question about that. And Stephanie, you have a large portfolio because, of course, you're serving coast to coast to coast across Canada, thinking about the vision for the country. And so I want to start us with that. So I'm wondering if you can speak a little bit about, from your perspective, from your vantage point, what are some of the population health and maybe broader mental health, substance use health, and disability health priorities for us in the country right now?
Sure, absolutely. And maybe I'll start just a little bit about what population health is. And
Great idea.
some people have seen different kinds of definitions, and some of them are really technical. But I find what sort of helped me to understand it is to think about population health as looking at the status of health of the entire population, but also the disparities within that. So, where some groups may not be achieving the same level of health, and that may be because of social determinants of health or history of a number of different things. So, it's the population health and the disparities within that. And to do that, there are a number of things that we need to do together to be able to capture that picture. And one of those is working across sectors,
Mhm.
looking at equity. As I mentioned, we're looking at disparities across health, not just the overarching piece. And yeah, applying those different lenses so that we can tailor the work that we're doing across the country to those and the needs that may differ by population, by geography, by all kinds of different contexts. So that's why I think population health as an approach is an important approach, not just for public health, but also across our whole system, because it really is about bringing the different pieces and threads together.
So it sounds like population health can really also be a bit of a vision setting exercise for the country as well. And as I'm thinking about this leadership exchange that we're heading towards, and we're going to be welcoming delegates internationally and from around the world, Can you speak a little bit about that balance that we're trying to kind of establish between talking about priorities within Canada and what we know we need to see within our own mental health and substance use health addiction and disability sectors, with also welcoming international delegates and making sure that that conversation is one where we can collectively learn as leaders?
Absolutely. And I think I just realized while you were talking, Sean, I didn't really answer your question about what our national priorities were. So maybe I'll just take 2 seconds
Sure.
to give you a sense of that, certainly from the federal perspective. So, as you know, in Canada, we are a federated system. We have health as a shared responsibility with provinces and territories, with the provinces mostly responsible for the delivery of services, including mental health, substance use, disability services, but we play an important role nationally in convening and coordinating and supporting that work. And we have some key priorities that have become more focused, I would say, in the last year or so, really focused on what we can move forward together with impact. So, for example, in mental health at a federal level, we are looking at continuing implementation of initiatives such as the 988 Suicide Crisis Helpline across the country with our partners. We are looking at continuing the implementation and integration of integrated youth services with provinces and territories across the country and what that looks like in a Canadian context, as well as substance related prevention of substance related harms and substance use health initiatives, which continue to be a high priority across the country. Canada is a big geography with a lot of different contexts in it. So all of these different priorities play out differently across the country, which is probably not unlike what we see internationally, where I think some of those are I think some of the same priorities that we're all facing, but they play out maybe differently. And that's the opportunity I think we have in GLE and bringing people together.
Thanks, Steph. And you're making me think because you said the word implementation, and you know my background is in implementation, so that makes me excited whenever Sony talks about implementation. And I think like one thing that you're talking about that I'm interested in getting your perspective about from that international and national kind of cohesion and vision and trying to work together is around that implementation because we know that some of the priorities that you mentioned, others internationally are also trying to implement some of those solutions or some of those innovations within their own countries. And we have this opportunity to learn from each other. But then there's also that localization or that contextualization that becomes very important. And so I'm wondering if you could speak a little bit to that from the federal perspective. How are you keeping an eye on all of these different moving parts where we want to learn from what's working well from others, but also making sure that we're working collaboratively with our provincial and territorial health systems as well?
I think it comes down to how we break silos down because silos don't help us move any of this forward. And we have to find a way of bringing those silos together. And a friend of mine just this morning called it to create the working farm.
I
And
love that.
so did I. So it's like that was really good. I'm gonna keep that in mind
That's
as we
yours
we
now.
talk about this. So how do you create that farm? And that means making those connections, building those relationships meaningfully so that we can share what's working and why and how what context. And fundamentally, that becomes down comes down to, as you said, how do we get things done? How did you do it? So, I see things that are happening in other countries and they look amazing, but I haven't really lifted up the hood to find out
Mhm.
how did it actually get done. And if I may, it sort of brings to mind a thought for me and where I sit in this whole big system, which is complex in Canada and complex internationally. But I think of sometimes, and many of you around these tables probably are like me. I'm a policy analyst at heart, a policy wonk, as we often say. And I sit at tables with different, sometimes it's provinces and territories, other partners, etc. Have you ever been at a table where people are starting to introduce what they're doing and they talk about all the great things that are happening, all of those innovations? And sometimes you get to the end of the table, I'm thinking to myself, well, we've got all of this figured out. We've figured everything out. If you listen to all of the things that are going around this table, but then when you leave that room and you go out into your home, into your community, and you ask people, did you hear about this? Or have you, how is it going for you? And they don't know what you're talking about.
Yeah.
And so that to me is an implementation gap. Somehow there's all these great ideas and then sometimes they don't quite make it to the people that are living these realities. And I think the opportunity that we have with GLE, and particularly with this GLE theme moving forward, is to look at how we connect the different parts of our system so that people can feel the difference, whether it's you've got a strategy, an action plan, an intervention, a program for people with lived experience. How do people feel the difference in that? And that's how we get things done. And I think that's where we can have real impact moving forward.
I love that. And it makes me think a lot about that sort of knowledge to practice gap that we know exists as well. We see this in sort of all of the incredible models, programs, solutions that have been developed. And I think you're right, Steph. We see so much. There's so much to leverage within Canada and internationally. And we also see it in that research zone too, where we have still that practice gap where what we know works really well still takes some time to get in action and getting done, as you said, and in that working farm mode. And so I guess I'm thinking ahead a little bit to the leadership exchange, and we'll welcome all of these international delegates to Canada. We do have some deep dive learning with the matches, which are the first couple of days of the week, and then moving into the plenary where we're all going to come together. And I guess I'm curious about, and I know you and I have been trying to think this through together. So, what is that balance between, or what do you think are some the hows of how we hit that balance between sharing what we're doing, but sharing it in a way that folks can come back and do something in real time with that information. Like that to me is the tricky piece of how we share and connect around knowledge.
Well, I think it's a two-way street. And so, I don't know if you've ever been in a situation where you've been working with somebody or talking to somebody in your personal life, my personal life, where you think somebody has understood you really well,
Yeah.
but they actually didn't. And I can give you lots of examples of that in my life. And I think that's something that we can look at as leaders. And
Mm,
it's not so much of giving my information to you, but how do we as leaders create the space to actually listen to other people and understand a little bit better other perspectives, including sometimes perspectives that might not be yours. And sometimes what you're doing and what you're sharing could be really important, but maybe there's another way to engage. And that's the kind of thing that I'm going to be looking for in June is to how do we create the space to learn from each other and listen better? And how can we be really practical? What do we put into motion? I don't have the answers to all of that. I think that's the opportunity that we have moving forward. Certainly in Canada, things are shifting, and there are some opportunities where there's a tremendous, I would say, momentum around improving mental health and creating space for other sectors to get involved at all different levels, community levels, local levels, parents, families, individuals, healthcare systems for sure, but other sectors. So, how do we create that common sort of platform where we can come together and give people really practical advice? And sometimes that advice is not, you need to do this, and this is the best intervention for X, Y, and Z that you've ever seen in your life. It might be, this is how I did it. This is
mm,
how I brought in other partners, vested other partners in this. This is how I created a champion in my community that was able to move this project forward. This is what I needed from the research community. I didn't need the research on, a bunch of things like I can't think of what. Sometimes you get research that you don't really need, and sometimes you get stuff that you really need. And
Hmm.
so, if we can create those frank and honest conversations amongst leaders, and I think the GLE over the years has created a safe space to do that, that kind of breaks the red tape out of the way, we will have succeeded.
It's interesting because you're talking a lot about the kind of that delineation between there's what we do or what we learn or the data we have, and then there's the how we're going to do it. And sometimes we overly focus on one or the other, but we really need both to kind of create flourishing systems. And I'm thinking a little bit about the integrated approach of the GLE to bring mental health and substance use and disability together. And really, a lot of the conversation leading up to this event in Canada has been a real desire to have more integrated conversations and think in more integrated ways. And so I'm wondering, you have a very broad perspective around population health, and that's a lot of integrated thinking. So I'm kind of curious about how can we make sure going into June that we're both respecting space and place for specific conversations so folks can have that deep learning while also really trying to bridge and kind of break down those silos, as you said, about integrated and have integrated conversations.
So it's a really good question. And for me personally, I think about what I want to learn. And I may be
Mm,
coming in with, from my own perspective as a federal government employee, and with a certain experience and a certain experience with the Global Leadership Exchange over many years. And I have to think about from my own leadership, what are the skill sets I'm looking for? What do I
mm,
want to see my future, not my future, but our future moving forward in public health? Who needs to be involved? Who haven't I involved?
mm,
How do we also create a structure where we can focus? And that is something challenging in a really complex system, which we're all working in, whatever that means, and living in, let's just say living in,
yeah,
because sometimes that system is such a web that it is overwhelming. And I'm hoping with the kind of conversations that we are setting up for June, that we can start to see our way through that web because there is a way through it. There are pathways through that that'll help us sort of move our ideas forward and ultimately mobilize solutions together, which we have to do moving forward. Nobody has all the money. Nobody has all of the solutions. We have to be looking more broadly, but creating that common understanding. If there's one or two things we do together, that's awesome. It doesn't have to be 20. And I think that's what I'm looking for moving
yeah.
forward is, and I think we have a tremendous opportunity right now, not just in mental health and substance related harms and substance use, but also with disability and with new partners that might be coming forward with priorities that will, I'm certain, resonate with all of us. That will be able to pick up and bring back to our own leadership in our own spheres of influence.
What you're saying also makes me think a lot about kind of knowing your strength and staying focused. And there's a
Mm.
really important piece around we're trying to transform and improve systems. Systems are complex and they take time to change. But there's a really individual component in that too, which you're speaking to, which is like knowing yourself as a leader and where you need to grow and having a growth mindset about that. And it does make me think that, and I love what you're saying about partnership, and how important partnership is, but like intentional partnership, that there's something to work on together and we can be focused. So with that in mind, I'm going to ask you, what do you think is the strength Canada has that we're bringing as a country to this international conversation? What can we share with others that we might be excelling in, and where might we have places to learn?
Excellent question. I think there's lots of places that we excel. I think in convening and networking and bringing different points of view together, we've lots to learn from other people. So when your question, Shauna, was kind of like, where are we excelling? I'm kind of tripping over a bit of my words, but I do think it's convening and networking. I think we have some wonderful researchers in Canada that are ready, willing, and able, and continue to sharing some of the innovations in Canada. Somebody recently said to me, Canada was the birthplace of health promotion because of the Ottawa Charter in 1986, which will be coming up on its 40 years. And if you go back and look at the elements of the Ottawa Charter around how we mobilize together, the roles of sectors, the roles of determinants that create the conditions to support positive health, positive mental health, how we develop healthy public policy. I don't have it in front of me, so that's kind of just by by memory. All of those things are as meaningful today as they were in 1986. And I think that's what Canada brings is that long history of creating that space to work together to create those relationships and have an open door to bring in different views and hear them out. I hope that kind of answers your question. I don't know.
Yeah, I like that perspective that kind of bringing diverse perspective and also I think being in a growth mindset is something we've really tried to cultivate to your point around having a lot to learn. So I'm very excited to welcome international delegates and kind of engage in that learning. And I guess, Steph, I'm thinking too. One thing that we haven't touched on too much in this conversation, but I think you've spoken to, I haven't asked it, I guess I'll say, but you've spoken to it, is the importance of humility in our leadership, and recognizing where we have to grow and where we have to learn and where we have to be accountable, and hold ourselves accountable and each other accountable. And so I guess one final sort of big question that I have, and then I want to turn it over to you to see if you have anything you'd like to add, is more of a personal question for you and your career, and you're a leader in our country, and what are some of the important characteristics and skills and capacities that you think embodies leadership and that maybe inspires you as a leader?
Well, the one question I didn't prepare. So off the cuff. We're just having a conversation. Um, I think first that the Global Leadership Exchange, this is exactly what the GLE can do and what makes it unique because it is about leadership. So, all of the things we've talked about on implementation, how you get things done, and those wicked problems that we're all trying to solve, and there's methods and academia and all kinds of research behind these things and life lessons through all of that all true doesn't happen unless you have good leaders. And this is the what GLE brings because the focus is on leadership and how we prepare our leaders for the future, how we take responsibility as leaders for the pieces that we can change and the pieces that we can't. As can't do everything. It's not all on our own shoulders individually. And I think for me, I'm not sure, I've forgotten exactly your question, but that humble leadership and knowing and listening and always being open to learning. We talk about learning health systems. I think of it as learning leadership. And for me personally, I had a mentor probably I don't know, maybe about 10 years ago, who came in and she was the director general for our Center for Health Promotion at the time. And she came into our group to say, my goal here is to create a learning opportunity for everybody in this organization. We are a learning organization, and I'm a learning leader. And I think that's a wonderful place to start. And that's part of being humble. It is being accountable. And it is about, as well, understanding that you can't fix everything by yourself. I think as leaders, sometimes we take everything on our shoulders, sometimes that we're here to fix things. And that can be challenging too. So, really understanding your own strengths, reaching out to others, understanding the system in which you work in, and really creating opportunities ongoing to learn and engage and inspire your team is, I think, part of the secret to success, not the only part. I'd love to hear your thoughts on that, Shauna.
I love that. And I think hearing about mentorship is so important and such an important part also of what GLE is trying to do and thinking about not only current leadership but future leadership and how we invest in that now. So that really resonates with me, Steph, and just being better together, recognizing and knowing that it's okay, permitting yourself to not have to do it all. And I think that helps us seek out others as well, that kind of have aligned vision and have aligned momentum. And yeah, humble leadership resonates a lot. So I think that's definitely something I also share and would and strive for and want to learn about. So thanks for
I
sharing
think
that.
in times of restraint, which all of us internationally are living at the moment, economic restraint, sometimes it feels like it's pulling you backwards in your leadership, in your work, in advancing some of these things, because it may feel like the opportunities are drying up. But in fact, there are opportunities moving forward, and maybe we do things differently, and maybe we can't do everything that we always did before. But there are others out there that are stepping up and at the table with us, and they can't do everything either. So it really is how you create that space for collaboration. And a good colleague of mine, actually, it was in a program that I took a couple of years ago, and I've spoken about this before because it really resonated with me. And it's a researcher in the US in management who talked about the importance of relationships, and that in fact, in a complex system, the performance of that system is directly related to the quality of the relationships within that system. And so often we're mapping the system, but we're not necessarily mapping how and who is connecting that system. And I think that's what GLE is trying to do.
I feel like we've talked about a lot of different topics. We've talked about implementation, we've talked about humble leadership, we've talked about learning from others internationally and partnership and collaboration. And I guess we're going to try to pull all of this together in June and invite others into those conversations with us as well. And I think we'll see a lot of these topics that you and I have talked about today also come to fruition in June. But I want to sort of give it to you to end our conversation today. You've been involved with the GLE for a while. You've been engaged. You've hosted different matches, conversations. You've attended, and now you're hosting as Canada with us. And so, anything you'd like to share with those who might be coming, and for those who might not be able to come, but we want to share that learning with them. So, final thoughts over to you, Steph.
Yeah, so as I said earlier, I'm really excited about June. I think for Canada, it's an opportunity for us to showcase not just Canada and its history and its Indigenous history and culture, which I think is so important from a learning perspective. As I said at the beginning, it's you have to go back in history to sort of see where things came from to plan for the future. And understanding and building that means that we have to address things from our history in Canada directly. We have to look at the opportunities, look at the cultures that we have across our country, and learn and build from them. And I think that is what's really exciting to me. We have matches across the country. Canada is not one island, it is different. And people coming to Canada are going to see that. And then we're coming together. And it is an opportunity to, as I say, showcase Canada, but also learn from each other about how we get things done. How do we work together and work across sectors and maybe with groups that we have had trouble working with before and keep an open mind of how we can learn. And I think from there, I hope that we can all go away with a new connection, a new opportunity to find that solution to that wicked problem that you might be facing in your work at home in your home country, your home neighborhoods, and make a lasting impression where we can really grow these networks together to take on the future. And I think there's just a tremendous opportunity there for all of us. I look forward to seeing everybody in June, either on virtual hybrid or in person. We've been working very closely at setting up some great opportunities to hear from different perspectives in the exchange on the Thursday and Friday, hearing about mentorship, hearing about how we support our workforce, hearing about leadership and connecting with other sectors. And quite frankly, I've said this multiple times in this podcast, how do we get things done? And I think the best way to do that is together.
What a note to end on. Thank you, Steph, for your time today and for all your insight and your thoughtfulness about approaching leadership in our country and welcoming international delegates, but also how do we create a global community? How do we connect?
Exactly.
And not do it alone is really my takeaway from today, and a good reminder because I think everybody in these sectors is trying to do complex system work, and it can feel lonely sometimes. Systems are hard to change, but I loved your sentiment in your conversation with your colleague that it's about the strength of relationships. And I'm gonna take that from our conversation today and keep that in mind.
Awesome. One last thing, which if you know
Yeah.
me, I always have one last thing to
Yes.
say. I just want to make sure as we're planning this, we are looking forward to hope and making sure, I think we have, and I think this conversation has been about hope, how we create that hope, how we create belonging together
Yes.
across our different sectors, our different countries. And I think that is part of the quote secret sauce to our future success.
Absolutely. Hope and belonging is absolute grounding pieces. So thank you, Steph, for your time today. And this is our launch podcast for this mini
Hey.
series. So it's lovely to be doing it with you as we've worked through this process together for over a year now. So it's been a long time coming, and it's going to be really exciting to see it come to fruition in June. So thank you for joining us today.
Wonderful working with you and the GLE team as well.